When bad things happen to children like abuse, starvation, or neglect, those traumatic experiences follow them throughout their lives. These adverse childhood experiences often lead to negative health outcomes. Locally, the Roanoke Valley Trauma Informed Community Network works to build understanding, compassion, and resilience among children who have experienced traumatic events. Decca Knight, a trauma specialist and licensed professional counselor, joins us to share more about their work and mission. Good morning. It's good to see you again, Decca.
Good morning. Good to see you again.
So give us a little bit more information about the Roanoke Valley Trauma Informed Community Network.
So we call it the Tickin for short. And the Tickin is a few years old. It was actually started by a group of individuals in the Roanoke Valley from a number of nonprofits who were interested in informing as many people as possible about trauma-informed care. And actually there are Tickins all throughout Virginia. There's over 20 in most of the larger and mid-sized cities. And what we do is we connect and network with organizations and businesses and school systems in the area to help them understand what adverse childhood experiences are and to help them understand how those adverse childhood experiences impact individuals throughout their life.
So I don't want to sound cliche, but we hear these buzzwords of trauma informed, all right?
Yeah.
And I think oftentimes people hear it, they get excited, they don't not exactly sure why they're getting excited when they hear that someone is trauma informed certified, but what exactly does trauma informed mean?
Well, I always like to say that becoming trauma informed is like a marathon, not a sprint. So when we're working with organizations to help them become trauma informed, it's not just a 2-hour training. It is training and more training and more training, and then a thorough assessment of the organization. You want to look at their policies. Are their policies trauma informed? You want to do an environmental scan, which means you walk into the building and you say, is this a place that seems safe to people who are coming in who may be dysregulated or overwhelmed or anxious? So really it is a very deep dive and a very long haul to help an organization become trauma informed. And that's one thing we've discovered as this buzzword has become more prevalent, is that a lot of people will say, well, we're a trauma informed organization, and they think they are trauma informed if they've done like an hour and a half training, and that's just not the case. So what the Tickins throughout Virginia are helping organizations to do is take that deeper dive.
And so what about school systems? Are we seeing more school systems getting this training? Is that require teachers to be trained? How does that pan out?
So school systems are not required at this point by the state to become trained in trauma-informed care, but a lot of school systems are. So here locally, Roanoke City and Roanoke County has had some trauma-informed training, but really becoming trauma-informed is a new thing in the past 5 years. And so in larger organizations like school systems, it takes a long time to kind of trickle down and trickle up, quite frankly. And so it is, like I said, a long haul, but a lot of school systems are beginning to understand the importance of becoming trauma-informed, as are a lot of healthcare systems, a lot of nonprofits and service agencies as well.
What would you say are the benefits for those organizations to become trauma-informed?
So there are a lot of benefits. It's really looking at behavior in a different way. A lot of times we talk about adverse childhood experiences, and that makes us think, oh, we're going to be trauma informed regarding children, but we really need to be trauma informed regarding adults too. When we see individuals, whether they're children or adults, acting in different ways, we call that dysregulation. Maybe they get aggressive easily, they get overwhelmed easily, they get anxious and shut down. It's really important for all organizations to understand that that may be rooted in trauma, whether it was trauma that was 15 years ago or it was trauma that was 2 days ago. And so quite often we look at behavior through the lens of trying to fix it or trying to shut it down. And a lot of times we don't even think about where it's coming from. So a phrase that we like to use a lot in trauma-informed care is, it's not what's wrong with you, it's what happened to you.
All right, well, we're going to want you to stick around as we learn more about how do organizations and individuals become trauma informed. Stay with us.